If you work with pelvic pain, chronic pain, trauma, high performing athletes, or clients who just don't fit the protocol, this episode can help. In this powerful conversation, I sit down with seasoned occupational therapist Elizabeth McBride as we unpack what it really means to work with neurodiverse populations in pelvic and orthopedic practice. We explore masking, sensory processing, executive function, trauma, and why many clients are profoundly disconnected from their bodies, even when they're elite performers. If you want to expand your clinical depth and better support neurodiverse clients, keep listening. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hi, everybody. Welcome to this episode, and I am super excited to introduce you to our guest, Elizabeth McBride. But before I do so, I just want to remind everybody about the Birth Healing Summit that is coming up May 2nd through 2nd and 3rd. It's going to be live online this year, and you can register for it coming up soon. So I just want you to save the date right now. Keep it in mind, and please join us. Know that we're going to be focusing on you, the practitioner, and helping you to do your own work so that you can better show up for your clients. So that is our focus. We have some amazing speakers lined up, and I know that you're going to get a lot out of the weekend. So I hope you'll join us May 2nd and 3rd. So save the date. We'll be opening registration soon. So please look out for that. So now let us dive into this episode. Elizabeth McBride is an occupational therapist. She is in Dallas, Texas. She has almost been an OT for almost 40 years. She's very close. And she is the owner of North Texas Therapy Innovations. Welcome to the podcast, Betty, as you go by, right?
Thanks. I know it's so goofy. I have a lot of names, so that's
You
so
do.
goofy. Hey, whatever. So, funny lady down
Awesome.
the street, whatever.
Well,
So,
I'm so glad you're here because this is, I think, an important topic that we as practitioners need to be aware of, and that is working with neurodivergent clients. So, how did you get into this, and what do we as practitioners need to know about these clients that are neurodivergent? And maybe
well,
even want to explain what that is too.
yes. Well, I pretty much came in the back door. I started, like everybody wanting to be a PT a million years ago. And I found out what OT was. And I was like, oh, no, that's creative. That's me. And so I got
Yes,
into it. I thought I was going to do sports medicine. Well, no,
we
I
all
did
did.
peds because, that's what you do. And I loved sensory integration. So I've been SIP certified. That means sensory integration praxis test certified. Oh, probably 34 years now. So
Okay.
that's a big deal. You can't even get that anymore.
Oh,
So
wow.
it's because I won't go down the trail.
Okay.
But anyway, I have treated kids that looked autistic, but we didn't have that name back in the day
Yep.
for years and years and years. And now I know what they are. And I understand there's like 3 levels, all these other things. So I still treat 50% kids that are neurodivergent. I'm actually considered neurodivergent because I'm ADHD and learning disabled.
Okay.
So, we've got these 2 ends of the spectrum. This is kind of how I see it as a practitioner. We've got
Uh-huh.
the autistic individuals, the ones that can talk to me are always right. I'm never right. And then over on this end, we have this little hyper people, ADHD, but some of those are really just can't focus. So we've got all this going on and everything in between. So I always say I'm the average person treating the most brilliant people in America because, like, I just worked with one this week, little guy, and it's like you have to come in the back door because you have to just let them show you what they can do. You cannot tell them what to do because they're not going to listen to you. That's what I mean. You know nothing. And I have that
Okay.
right here as a pelvic health therapist also. I know nothing until they really start to trust me because they love this word called masking, especially women that are autistic. They have masked all their life. That means they have been able to get along with the world. Now, you and
Mhm.
I can get along with the world really well. I mean, I'm super extroverted. I can
Yeah.
talk up a mile. I can have a fun time all the time. I always call it the party in the back room in the treatment gym. Yes, and we do have a zip line through it, by the way. So we're always having a fun time back there. There's just like 5 practitioners going. It's super fun, but they don't trust us yet. So that is our big deal, is getting these people to trust themselves, and also teaching them how to go back and enjoy their inner child. I hear exciting things all the time with that. So really, as practitioners, when we work with this population, you have to be half psych, half phys diz.
Oh, okay. So I was just at combined sections meeting for the APTA, and that's our annual conference. And there was a talk on pain languages. And this doctor or this therapist who does research around pain and what the messages of pain is really all about. And it was so good, so fascinating. But I loved his statement, Betty, was someone had asked, well, isn't this therapy, like psychotherapy versus physical therapy? And are we crossing a line by going into psychotherapy? And he goes, you know what? We're physical therapists. Sometimes it's physical, sometimes it's therapy.
That's a great way to state it. I love it.
I love that too.
I do. I always call myself as an OT. I call us the Jello people. We go between every kind of therapy and doctor and pull them together. In fact, when my patients get off the table, today I had one, and she was just like, I really am Jello, just like you always say. And then I said, well, what color do you think you are? She goes, well, I'm rainbow. She thinks she might be on the spectrum. So she's like, well, I'm rainbow. I was like, that's so wonderful. And I asked, what color are you? What color am I? She goes, well, you're even more vibrant rainbow than me.
Oh, that's
whatever.
So
yeah. But I just feel like we have such a creative way. And it's like, people are always asking me, when are you going to retire? I'm like, never, because this is a gift. It's a gift to be able to put your hands on people and get them out of fight or flight. And that is the coolest part. Before I got into pelvic health, because I'm late to the game here. I've probably 4 years been working on it. And it was kind of a natural occurrence. But, people would come lay on my table and say, oh, you're the best pelvic health therapist I've ever been to. And I'm like, I am just doing cranial, because I've been a cranial therapist, probably 28, 29 years now. And I've done lymph drainage, visceral manipulation, myofascial. I've done manual therapy forever, and myofascia, I think it's like 37 years. So I've just been doing it forever. And it kind of really mixed in, because I was always trying to get my kids to lower their engines. That was, or rev their engines back up. And it's the perfect way to do it. Like I can do it in my big gym, like sit on a piece of equipment with a kid and put my hands on them. Also, they always called me the poop queen, because I could always get a kid to poop that couldn't poop. And this is way before I thought about being a pelvic health therapist. Way before. Yeah. Just because of cranial or myofascia or whatever. So
it's all connected. And I personally, and I know you've taken, I think, almost every course I've written, but our hands are between the skin front to back. We're making effective change on every single structure between our hands. So, there are cranial techniques. Yes, there are lymph drainage techniques and visceral techniques and everything. But I think once you get to the point, you don't really separate the techniques.
True.
As much.
And I kind of call it the Betty McBride way, but it's not. It's like the Lynn, because, I just took Lynn's big, long course. The
birthing 9-month intensive.
Yes. And it was amazing, because she really does an amazing job pulling it all together, all the different types of therapy. And she actually works on everybody being able to feel that energy between their hands, and it really does, because it's as a pelvic health therapist, 99% of my people, when they come in, they do not want me to do internal work. They want me to really just work on the trauma from all the things that they have had over the years. So that can be done, and it can be done distance wise too. It's super cool, but it's so neat, because I can sit with a nonverbal person and work on them away from their body. And, while they're in the room or while they're gone, because I have a lot of nonverbal individuals that really can't describe what's going on, but their parents are
Mhm.
like, but they're making huge difference. And we're talking, these are individuals that are 25, 28. They're older and like, at special
Yeah.
schools or at work programs, things like that. So it's really fun.
That's awesome. Okay, so a neurodivergent person is someone on the autistic spectrum,
True.
ADHD,
Or learning disability.
or any learning disability.
And it can be like cerebral, it's anything with a disability.
Okay. Okay.
Yes.
All
Yes.
right.
And it's this huge list now.
Yeah.
And
Yeah.
during COVID, it got much bigger because everybody had time. We're online. It's amazing how many people
Ah,
decided they were neurodivergent over COVID. And,
interesting.
testing is coming out of the wazoo at this point of people. And, people will come in and I'll go, I would have never thought that. But then I think back on it and go, oh, yeah, you are, and like I never really thought I was until they all kept going, well, you are too, because you're
Yeah.
ADHD and this. And I was like, oh, yeah.
Okay. So, Betty, do you think that because you are in that you relate better to these people, or, what is it that we as practitioners can do to better relate to clients that possibly have this, neurodivergent?
It's kind of just taking that, just take off the I know everything out of your brain.
Okay.
Remember, their body knows it all. They do
Ah,
know it all. Like when you put your hands on, they know it. You don't. And the body does not, what is our term? Does not tell lies.
right.
And so
Yes.
their brains might. Now they might be telling you that, but their body's not going to tell you that. And
Well, what I find with, I've only had a couple that I can think of right now that
mhm,
I've worked with. To me, they are very disconnected from their body.
exactly. As I always say, they're the absent-minded professor in a lot of ways. They're a brain, but their body, like they're usually sometimes they're uncoordinated, but sometimes they're not. And see,
Yeah.
that's what I have to snag them on for insurance because I still take insurance.
Okay.
And you have to snag it on and that kind of thing because I'm still not able. I can now bill psych supposedly,
Yeah.
um, but you have to snag it upon something that in their clinical observations or some kind of test that says they've got deficits in these certain areas,
Right.
you
Okay.
know.
Yeah.
And most of them are not going to tell you the trauma. They like coming to me because I don't need to hear all the trauma.
Yeah.
They're just going to let their body do the work. They don't want to
Yeah.
really relive all the trauma. Most of
Yeah.
them. Some of them do. Some of them love telling you everything.
Right.
It depends. Yeah.
Yeah. I actually have a client that is on that spectrum, and she is coming to me. She's done the coast to coast bike ride
Oh, cool.
with a team, and 60, I don't know, 11 days and so many hours was like the fastest she's done from coast to coast, but 11 days on the bike in that position. And I find this in extreme athletes as well. Like, they are very disconnected from their body
Yes.
because they've just got to push their body beyond the limit, so they can't listen to it to be
Right.
able to perform the extreme sport that they want to perform.
Right.
Her head, she could not hold up her head because it would, like, her muscles had fatigued so much
Oh, wow.
during this. And she was actually coming to me for pelvic. Well, her therapist was bringing her to me to help her to connect in to her pelvic space. But I've had to start with her neck and shoulders first to
Wow.
even, get her in touch with
Of
her
course you did.
body first before I could even go down into her pelvic space. And like, I've seen her multiple sessions, and I think it was probably like the eighth session that we could actually go into the pelvis.
Hmm. Hmm.
Yeah.
Um, I do use a tool. It's called the sensory profile, and there's one for babies, middle-aged kids, and then adults. And it really tells me if they're too high in a certain sensory level, too low in a certain sensory level. I mean, it's an amazing tool. I'd love, to share
Hmm.
this with you sometime, Lynn, just
Yeah.
how it works. And because that's part of my eval. And
Okay.
it really gives me an idea of where they are, but that's the least of my eval. Usually when I come in, on an eval. They want treatment. And I agree with you on that. They don't want me to, because I had this one patient, she came in and she would only let me touch her left bottom rib. That was it. That was where I got to start. That was it. You know, because she'd had so much trauma, she'd masked so much. She's very good at verbalizing everything to me, helping me come up with names of things, all kinds of stuff. I let my students run a lot of their capstones with her and all these kind of things. But anyway, so I started there. But now, like, I can do her head. I've had her for 3 years, all over her body, everywhere. You know, and then we use the male female side of, you know, we've done all kinds of great work. And, you know, she's blossoming. It's amazing. She's a totally different person than she was.
Wow.
And yeah.
But it really is about starting small with people on the, you know, neurodivergent.
Yes.
That we need to start small and go slow.
Very slow, because she didn't talk to me for almost a year.
Wow.
And kept me back, but was making progress. I could see the progress. So I just want you to know, sometimes it takes that slow.
Yeah. Wow. What else do you want us to know as practitioners working with these clients?
Well, every one of them are totally different, because it is a spectrum.
Yep.
And, you know, okay, so autism is 3 levels, depending on how much help they need from others, kind of thing. Because I have some autistic individuals that it'll take 4 practitioners at one point. So I use grad students with me. It's just so much work. They love my table. I do have a frequency mat, and, you know, I have a thing called the beamer. I use it. And I have some other frequency items that I use for energy work. They love that. They love sound frequency. I have like 6 different sound frequency things I've been certified in. So I use a lot of that. You know, it's just being open and really collaborating with other practitioners that are working more in that neuro area of sensory integration, sensory processing disorders, where you have to go and really think out of the box. I'm going to be type B, not type A, and sit back and let that body talk to you. Don't.
Okay. That's what you mean by type B versus type A. So type A is more, we're going to direct this, we're going to do this, A, B, we're going to, you know, impart onto the body, versus part B just being more passive and more receptive to what the body's trying to tell us.
Exactly.
Yeah. Because I find these clients don't really know their body, and they don't know what their body's trying to say. So if anything, these clients really need us to be able to listen and read the story of their body and work with them in that way.
Right. And I also know when they come in, they want to lay on the adults want to lay on my table. They want to be worked on. So I have to slowly move them into eventually some exercise and some other things to actually aid them throughout the time. Even doing our pelvic bowl sweep, those kinds of things, I have to direct them to this, and you know, those kinds of things, and work them on getting them back to the back room so we can work on some more executive functioning to actually help them embody themselves. Yes.
What do you find by doing executive functionings? How does that help them embody more?
Well, it's one odd thing. I just did it before I came on here, so I wouldn't have word finding problems, because I have that. It's called interactive metronome, and it helps the 2 sides of the brain to actually talk to each other better. So, you know, we'll start with exercise once they get used to enjoying that I can get them out of fight or flight. And I also find out where are their points of pain before they walk in the door, and where is it out of 100. You know, instead of out of 10, I use a 100 scale. So, like, you know, like, is it jaw, neck, lower back, upper, you know, those kind of things. And then I also do anxiety. I always do anxiety. Where are you with your anxiety? And then at the end, I get the score. So I show on my note, since I have to do insurance, how much progress they have made. So insurance doesn't have to worry about it. And I always put some physical, not just some mental. You know, because anxiety, they might not let me do. And but I think executive functioning goes right along with getting the body coordinated, because your executive functioning gets better as your body gets more coordinated, and the 2 halves of the brain talk to each other more.
Yeah. Yeah.
So,
I love that. Brain gym. Wasn't it called brain gym?
yeah, that's a great one. It's a great
Yeah.
one.
Yeah.
Hmm.
Doing opposite hands to
Hmm.
knees and cross crawl and
Oh,
a lot
it's
of,
a
yeah, cross
yeah. I send a
body.
lot of people back to crawling.
Yeah.
I really do. Like that will be part of their exercises, that I give to. And some people don't do the exercising. I know
Yeah.
I'm in PT right now. I don't do the exercises as well as I should. Of course, I'm
Yep.
B minus.
Yeah. 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 Yeah.
Yeah.
Yeah.
So
Awesome. What else do we need to know as practitioners when we encounter clients that have this diagnosis for us? You had said
if
something
you
about like you find that a lot of people that have that are neurodivergent, that they have a lot of trauma in their
They
body.
do a lot, and a lot of it is just from the masking that they have to do. But other
Mm,
of it might be from what happened in school to them, or how
yeah.
parents treated them, or
Yeah.
even some of the types of therapy they had to endure as children.
Oh,
And
wow.
you hear all kinds of stories. And because I treat a lot of adults that, the reason I got to this point is because my kids that I worked with all grew up. And so they're still coming. Some of them
Ah,
are still coming to me. So they're not kids
yeah.
anymore. They're adults.
Yeah. Yeah.
And
Yeah.
so, yes, that you have to listen to them and believe them and
Mhm.
just be a safe place for them to
Yeah.
tell you what happened to them, you know, and do refer out. That is another big one, just refer out to counselors, psychiatrists, you name it. You have to have that list. I've got my EMDR
Yeah.
therapist. I have, my behavioral therapy, I have my neuropsych people. I have my list, but that's
Yeah.
something you grow over time as you get those, because you're not an island. We
Right.
have a play
Right.
therapist here, and she also does adult with EMDR. So, I've got
Yep.
it all happening. Trying
Yeah.
to, I don't try to make it all happen for it all. And that's another thing. I always feel like I don't know everything, and I will, lifelong learners. We need to be lifelong
Yeah.
learners. We are not the go all end all, and that's what we
Right.
have to kind of not have. We need to have pride in ourselves, but not that pride that gets in people's faces, kind of thing.
Right.
Like I know it all, because we
Yeah.
don't. The other
Right.
person knows. They know, you know
Well, if their mind doesn't, their body does.
exactly,
And
exactly,
if
and
we can listen to that, that can guide us.
yes, and especially that pelvic bowl, getting the person into that pelvic bowl will get rid of so much anxiety and
Yes.
trauma. You can just work through that you know, all of
Yeah.
that from the Tammy Lynn
Cranial
Kent, right?
intent. Yep. Yeah.
Yes, I
The
know.
holistic pelvic care is an amazing,
Yeah, I send
amazing
people to
work.
that book all the time now.
Yeah. Yep.
I one chapter at a time, just read these chapters,
Yep.
I'm
Yep.
always like little tiny pieces of it.
Yep.
So,
Yeah. Yeah.
yeah.
Yeah, I love that because it truly, like for me, my goal with my clients is always to see if they can't get down to the bottom of their bowl and live from the bottom of their bowl. And
Hmm.
very few people are actually doing that in this day and age. And I can't even imagine with everything that these clients that are dealing
Right.
with this, the neurodivergent,
Or the
they,
sensory, I call it sensory processing because that's the overall. But, we have this triangle in sensory processing. And at the bottom is like proprioception and vestibular. It's all these motor planning type things. And that is what the bowl represents because it is our
uh,
anchor of where all this comes from.
yeah,
And at the top is like all the little fine motor skills and fine motor thinking. And you've got to get down to your bowl in order to make all that happen.
right,
So it's a
right.
very interesting study how all this really, really works together.
Yeah.
It's like I'd love to do a ton of, have one of my grad students, not me, of course. I'll just come up with the idea, but have them study that. What is bowl? How do we get people there that are having sensory processing disorder issues?
Yeah,
So,
yeah. And like, well, the pelvis is our foundation. It's our
mhm.
home. It's what translates forces from the legs up into the trunk. And, and if we are not weight bearing through the pelvis, our shoulders actually become weight bearing structures in our body. And it's so foundational that we need to get people connected to that pelvis. We need to get that pelvis nice and happy and moving freely so that and stable
Hmm.
so that we can live from there. Like that truly is our home. And so even no matter what the diagnosis our clients come to, it really does
Right.
all come back down to getting us embodied and into the bottom of our pelvis, our
Right.
bowl.
And in good alignment
Yes.
throughout.
Yeah.
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 And I mean, even though I'm an OT and y'all are the specialists in that area, I can look at people and so, oh my, okay,
Yeah.
that kind of
Yeah.
thing. And I know when to send a PT,
Yeah,
that kind of
yeah.
thing.
Well, I think OTs are great for pelvic health and what they
Hmm.
bring to that picture. And I think there's a lot of amazing OTs out there that are doing amazing work in pelvic health.
Right.
And yeah, we
Yeah.
all have the capacity to do all of this if we so choose.
Right.
So yeah, awesome. Any last little tidbits, any last little information that you want?
And I really don't be scared of what sensory processing, sensory integration. Find some good podcasts, listen to them,
Yeah.
and try to understand. Open your mind up because it is very neuro.
Mhm.
It's not as orthopedic as a
Yeah.
lot of pelvic health is, and that's where I've had to come over. Oh, I got to be a little more orthopedic here, and I
Yeah.
kind of realized I don't have to be. But it's like, but
Yeah.
we have to realize that the mixing of the two is where it looks like it's going now, is that we have to
Mhm.
mix, the psych, we have to mix the sensory along with the pelvic health because we're looking at the total person, not just one
Yeah.
part. Because really all people want is to be respected. They want to be loved and respected. And no
Absolutely.
matter what the diagnosis, no diagnosis, that's what they want. And our hands are allowed to do that. And it's such a privilege to be able to just touch somebody and allow them to feel respected and feel loved. So,
Yeah. Oh gosh. I remember you and I connecting on that love piece and just
mhm.
our touch is that love flowing through our hands and that's really the ticket for everything. And I do feel that these sensory processing issues that are in some people, they don't like being touched. So we got to
Right,
get creative and figure
right.
out, what's the angle. I love you say coming in the back door
Yeah.
to
Well,
these
and
people.
everybody has sensory issues. It's just some are more heightened.
Yes.
And then there's other little issues on top. And I try not to look at people for their issues. I try to just go, okay, well, what's going to take
Yes.
us to the next level? How are we going to
Yes.
get there?
Yes.
That kind of thing. Just like for my kids, I always tell the parents, if we work on you and get you out of fight or flight, it's going to make your kid go so much faster, so
Wow.
mhm.
Yeah, that's so true.
Kind of
So,
that
so true.
oxygen mask,
Yes. Yeah. Take
so
care of you first before. I always wondered how psychotherapists that work just with children, I'm like, how does that even work? Because it's the parents that you really need to work with.
yeah, you
And
need to work with the whole family.
yeah, and you
Yeah.
can't just, but there's always a way in, right?
Hmm.
And if the parent's not willing to do their own work and, oh, just fix my kid, well,
Right.
you got to start somewhere.
Right. Right.
Yeah.
Exactly.
Yeah.
Yeah.
We all just have to find a way in. And
Hmm.
there, thank goodness there's lots of different ways in and lot of different ways for us to work with the people that show up in our clients. Is there a way, I know most people that have this diagnosis or have this understanding are aware of it, but is there anything that we should be looking out for in some clients that might not be aware that they're dealing with this?
It's just really hard because it has to be their understanding and coming to it. A lot of times if they don't understand it, they will eventually understand it. Because I've been with so many people when they had their aha moments that, oh, I really am this,
Yeah.
and
Yeah.
with this day of everybody getting online and looking, it's a lot less than it used to be
Yeah.
because but it is nice to if somebody starts asking you about it, you can say, well, I do see that you have a lot of problems with touch or light touch or whatever, so you can just start some conversations like that. I notice that you are very sensitive to these sounds. I notice this, your processing is a little off. You can say things like that. I never really, sometimes I will tell a parent or a kid or an adult, if they really ask me point blank, I'll go, yes, I would go ahead and get that looked at.
Yeah.
But
Yeah.
I pretty much have learned I don't want to be the first step because I can't diagnose that.
Right. We can't, and
Yeah,
we
we can't.
shouldn't. No.
But I can say, yes, you have severe sensory processing disorder. I can say that one, and I
Mhm.
can say, yes, you have, all your senses are off, and especially your inner sense, your vestibular system, which is on top of your inner ear, gives you balance, makes, all
Yeah.
that happen, or your proprioception, which, as PTs, y'all know that one, as OTs, we know it. But then there's interoception. It's how we
Mhm.
understand all the emotions coming out from all those senses. So there's so many words and there's so many great podcasts now about all this. It's amazing, amazing work out there. So it's just like a privilege to be able to work with this because
Mhm.
there's, I don't know many people putting them together for adults at all in pelvic health at all. So
Yeah.
it's kind of a new area, really.
Okay. Yeah.
Yeah.
Yeah. And so really looking at the vestibular, the balance, the interoception, proprioception, like
And
it's
then all the other, hearing, seeing, smelling,
all those
tasting,
sensors,
it's
sensories.
just
Yeah.
it's huge, and
Yeah.
how they regulate together, and
Yeah.
every day is a different day for that person.
Oh, that's
That
important for us to know.
very important because some days they'll come in and it was like the worst day ever, and especially if they haven't worked through their mental health process, that even
Mhm.
makes it more, you know. So
Yeah.
yeah, and we have to make sure that we're as clear as possible when we work with them, so we can be there for them,
And
kind
what
of
do you
thing.
mean by that, Liz,
Um,
Betty?
Grounded,
Ah,
like
okay.
we have to be grounded. We have to put our feet on the ground. We have to make sure that our pelvic bowl is grounded, that we feel like we can handle this person,
Okay.
kind of
Yeah.
thing.
Yeah.
And whatever comes, because you know what, it's not about you. It's about you're
Right.
putting your hands upon them and with respect and love and really just giving to them. But you don't want to give to them out of an empty self, but a full self.
And that's what our Birth Healing Summit is about this year, everybody. We're going to be talking about grounding and embodying ourselves.
Good,
And
good.
yeah, that's the focus so that we can show up more powerfully to assist whomever is in front of us with whatever they show up with so that we don't get triggered. And that we can, I always say we can't help someone where we haven't gone already ourselves.
Right.
And
Work your process.
yes,
Get through it. Yeah.
yeah, heal yourself so you can be a better person to help others do their own healing as
Mm-hmm.
well.
Mm-hmm.
And so, yeah, that to me is very important for this population. And it does feel like people are becoming more and more aware of it. And I think as practitioners, we just need to meet them where they're at, respect them for where they're at, and get creative in how to best approach these clients to best support them in their healing and recognize that there may be a lot of trauma in their system
Mm-hmm.
that needs to be addressed first. So I love the idea of working with other practitioners to support these clients.
Right. And just helping them understand big T's versus little T's, big traumas versus little. I mean, just a lot of education with them. A lot of times you'll be their first stop. You
Yeah.
don't
Yeah.
know, you
Yeah.
know, and so that's why having others to send them to is such a great thing.
Yeah.
But not too
Sounds
many at once. That's another one because they'll get overwhelmed easily.
Yeah,
Yeah.
yeah. Okay. So go slow, everybody. Know that the body, try to listen to the body as best we can, understand that there might be trauma there, and just respect and offer love
Mm-hmm.
to these clients. Yeah.
Definitely.
Awesome. Awesome. Well, thank you, Betty, so much for
Thank
sharing your
you.
wisdom with us. And so grateful for the work that you're doing in the world. North Texas is very, very lucky to have you
Well,
and your
it's a
clinic.
fun place. It's a fun place to be sometimes.
Well, I want to come check it out.
Well, you are. You're coming in October, right?
I will be in Dallas teaching and
Yes.
yeah, so I'm going to come check out your clinic, Betty.
Yes, you can come lay on my table with all the frequency. Yes.
Awesome. That sounds amazing. Sounds amazing. All right,
Okay.
guys. Well, come join us in October in Dallas, everyone. Would love to see you there. So thank you so much for listening
Thanks.
in, everybody. Thank you, Betty, for sharing your wisdom with us, and we will see you all on the next episode. Thanks so much for listening in. Take care, everybody. Bye-bye.
Bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code podcast50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.